So next topic of your syllabus is RICKETTSIAE. RICKETTSIAE, they are also a group of bacteria. They are gram-negative bacilli. They take a rod shape. So they are obligate intracellular parasites. So means they survive after entering the cells of parasites. So they are called as obligate intracellular parasites. So they are gram-negative bacilli, a group of bacteria called as RICKETTSIAE. So actually they are parasites of arthropods. You all know jointed leg animals. They are called as arthropods. They are actually mainly parasites of arthropods such as lice, fleas, tick and mites. So in them they survive in the alimentary canal. So you find RICKETTSIAE bacilli in the alimentary canal of lice, fleas, ticks and mites. In a vertebrate such as human beings, including human beings, they infect vascular endothelium and reticuloendothelial cells. So in human beings, it infects endothelium of the blood vessels and reticuloendothelial cells. So the family RICKETTSIAE is named after Howard Taylor Ricketts. So he was a microbiologist. So he discovered the spotted fever rickettsia in the year 1909. So he died because of infection by this in rickettsia bacilli only. So he died of typhus fever. While doing studies on rickettsia bacilli, he got infected by himself and he died of typhus fever. So these group of bacteria are named after his name as RICKETTSIAE. So the name of the family is after the name of microbiologist Howard Taylor Ricketts, so who discovered spotted fever, and he died of typhus fever during his study on RICKETTSIAE family of bacteria. Family RICKETTSIAE is classified into 4 genera containing species causing infections among human beings. They are RICKETTSIAE, Rickettsia, Rocalmia, Oxiella, Ehrlichia. So these are the 4 genera in the family RICKETTSIAE. There are many groups of bacteria which cause infection among human beings also. The morphology of RICKETTSIAE. In smears from infected tissues, if you take out the sample from the infected tissue, so if you put on a smears, Rickettsia appear as a pleomorphic coxobacilli. As we discussed, coxobacilli have a intermediate size and shape between the cocci and bacilli. So the pleomorphic nature is there for Rickettsia also because they don't have any fixed size and shape. So but they appear as a intermediate size and shape between cocci and bacilli. So means coxobacilli, not rod shape, not round. So pleomorphic coxobacilli. So the size is 0.3 to 0.6 micrometer into 0.8 to 2 micrometer in size. So they are non-motile and non-capsulated. They don't have any capsule and they are not motile. They don't show any motion. And they are gram negative. So they do not take any stain well, but they are recognized as gram negative. And they stain bluish purple with the Gimsa and Castaneda stains, and a deep red with Machiavella and ginseng stains. So under the electron microscope, if you study Rickettsia, they seen to have a 3-layered cell wall. So Rickettsia have 3-layered cell wall and a trilaminar plasma membrane, so which resembles gram-negative bacteria. So ribosome like particles are also seen in intracytoplasmic organelles. So they have been observed in the granular cytoplasm. So that is about morphology of Rickettsia. Rickettsial diseases of human beings. Different species of Rickettsia group, they lead to different infections among people all over the world. You can find everywhere. They are found, and they lead to infections like a typhus group of fevers, spotted fever, scrub typhus, and rocalimiaceae. Many different types of infections they lead to. They have given species, disease, different types of diseases they are causing, and vectors also they have mentioned, and the vertebrate reservoirs, so including human being and all they have given, and geographical distribution of different types of infections caused by different species of Rickettsia. That is well explained in this table. You can go through that table. Rickettsia, so one of the group of bacteria which are gram-negative bacilli. They are obligate intracellular parasites, and they are parasites on arthropods such as lice, fleas, ticks, and mites. So these group of bacteria they are parasites on lice, fleas, ticks, and mites. So they even infect the human beings also. They cause infection in endothelium of the blood vessels and reticuloendothelial cells. So let us continue with a pathogenesis of rickettsia. So these rickettsia they are generally transmitted to human beings by arthropods. So they act as a vectors means carriers. So they carry the rickettsia to the human beings. So after the bite of the vectors, that is arthropods, like mites, lice, fleas, ticks. So when they bite or when they pass their stool, when that stool enters the spores in the skin, so that leads to the infection among the human beings. So when the rickettsia entry into the human body, they multiply locally in that entry site. They start multiplying and then they enter into the blood. So they become localized actually, and they cause a vascular endothelial cells. So they cause a enlargement and degeneration and some inflammation at the blood vessels, endothelial cells, and even that leads to thrombus formation. Thrombus means clot formation. So there will be an inflammation of the endothelium of the blood vessels, and then there will be a swelling, enlargement, and there will be a degeneration, and even there will be a clot formation, that is called as thrombus formation. So next there will be a partial or complete occlusion of the vascular lumen, means there will be a blockage of the blood vessels. The overall pathological features of a rickettsial diseases, they are similar to that of damage to the endothelial cells of bloods. So rickettsia they enter the through any site and they start multiplying at that localized area. Then they enter into the blood, they start causing inflammation of the endothelium of blood vessels. So the pathology is all based on that only. And then rickettsia they exhibit two kinds of toxicity. One is endotoxin and another one is hemolysis. So hemolysis, endotoxin they kill the mice when they have observed they have extracted the endotoxin and they have injected it in a mice, and after injection so the mice has died. So this endotoxin is very toxic. And second toxic activity it is hemolysis. There will be a breakdown of the blood starts breaking down and it leads to coagulation, clotting. So that is the pathology diseases caused by rickettsia. As we have discussed, there are many different types of species in the group rickettsia. So let us discuss the different types of rickettsia bacteria. They cause different types of diseases. So first one among that is typhus fever. Typhus fever, it is very common in Russia and Eastern Europe. So Russia and Europe, you can find typhus fever very commonly. So in the year 1917 to 1922, there were about around 25 million cases in Russia. There was an endemic. So around 3 million deaths were there due to typhus fever. It was very dangerous that time, epidemic in Russia and Europe. And it killed around 3 million people. So next, that is very common in Russia and Europe. The causative agent, that is species of RICKETTSIAE for typhus fever, is RICKETTSIAE proazeki. So the name, this species was named after von Provazic. So he was a person who got infected from Rickettsia prowazekii during his investigation of the disease. So when he was doing an investigation about the disease, he got infected from this typhus fever, that species of the Rickettsia prowazekii. He got infected from Rickettsia prowazekii and he suffered from typhus fever. So the species was named after him, that is Rickettsia prowazekii. So human beings, they are only natural vertebrate hosts. So human beings, they suffer from Rickettsia prowazekii. So even the flying squirrels, they act as a reservoir hosts. So they get infected and they keep the rickettsia in their body, and they keep on infecting the human beings. So everywhere. So especially in USA also, the squirrels act as a reservoir hosts. Reservoir hosts means the rickettsia enters in their body. They may not suffer from any disease, but they keep the organism in their body. They keep on transmitting that organism to others. That is called as reservoir hosts. So in USA, that squirrels, they act as reservoir hosts. So they keep on infecting human beings. The incubation period of typhus fever is around 5 to 21 days. So entry of the rickettsia prowazekii into the body of human body and appearance of the first symptom is known as incubation period. So that is from 5 days to 21 days. So the symptoms, they start appearing between 5 to 21 days. Fever will be there, chills will be there. It will be resembling any other infections actually, but a typical rashes, they start appearing on the fourth or fifth day. So that will help in making the diagnosis of typhus fever. Very typical rashes start appearing. They will be macular or maculopapular. So rashes will be there. They will be there in the trunk, so abdomen or back. They spread to the limbs also, upper limbs and lower limbs. So they start appearing. There will not be any rashes on the face and palms and soles. So there will not be any rashes in the palms and soles and face. So rest all the body, there will be a rashes. So the fever will start appearing from the beginning. Fever will be there, chills will be there, and typical rashes of typhus fever, they start appearing from 4th to 5th days. So all over the body there will be a rashes. So on second week, the patient will become stuporous and delirious. So the person will lose the consciousness, orientation, and he will become very disturbed, and he will be agitated. There will be a clouding of consciousness. That's how the name typhus has come. Typhus, the meaning is clouding or cloud or smoke. So there will be a clouding of consciousness. The person will be disoriented. He will not be in touch with the reality, surrounding environment. So that clouding of consciousness, that's how the name has come, typhus fever. So it is because of Rickettsia prowazekii, one of the species of Rickettsia. It causes a fever, chills, clouding of consciousness, and rashes all over the body. So mainly it affects the endothelium of the blood vessels and lymphoid tissues and all other organs of our body. So that is about a typhus fever, one of the infection caused by Rickettsia prowazekii species. So this name has come from the von Prozac. So the person who was doing the investigation on this species of Rickettsia, he got infected from the Rickettsia prozaki. So the name was given after his name. So mainly the squirrels, they act as a reservoir hosts. So arthropods such as squirrels and other guinea pigs, mice, and rabbits, rats, they also get infected, and they act as a natural transmitters of infection. So this is about typhus fever. Another disease caused by Rickettsia, the group Rickettsia, in that species Rickettsiae, Rickettsiae. So this species causes an infection called as spotted fever among human beings. So this is a group of tick-borne infections actually. They are caused by a members of a genus Rickettsia. So Rocky Mountain spotted fever, it is called as Rocky Mountain spotted fever. It is a illness which is caused by Rickettsiae. So a bacterial pathogen which is transmitted from ticks to the human beings. The human beings, they get infection from the ticks. Rickettsiae is a causative agent of Rocky Mountain spotted fever. Rocky Mountain spotted fever. RMSF, it is called as Rocky Mountain spotted fever. Causative organism is Rickettsiae. So Rocky Mountain spotted fever is caused by Rickettsiae is characterized by fever, chills, body pain, weakness, and there will be a typical rashes all over the body. So there will be a rashes even in the soles and palms also. You can find a fever, maculopapular rashes, and there will be mainly a flexor aspects of a wrist and ankle. There will be a rashes first. Flexor aspects of the wrist and ankle, you find rashes, macular or maculopapular. So there will be a maculopapular patches or rashes on the flexor aspect of the wrist and ankle. Then they start spreading all over the body, including palms and soles. There will be a patches. So you can find patches all over the body later, and even inside the mouth also, buccal cavity, buccal mucosa also, you can find maculopapular patches. So this is one of the typical features. So fever, weakness, body pain, and maculopapular rashes all over the body, including palms and soles. So the causative organism for spotted fever is Rickettsiae. So Rocky Mountain spotted fever, it is otherwise called as. So next let us discuss about another infection caused by Rickettsia group of bacteria. In that species Rickettsia quintana. So quintana meaning is 5 days. So means this trench fever we are going to discuss now. Trench fever, it is otherwise called as 5-day fever or quinton fever. So the meaning of this quinton is 5 days. So the fever is same like a trench fever actually. So what we have discussed earlier, there will be a body pain, weakness, high fever, chills, all that will be there. In association with that, there will be a pain of the joints. The person will be suffering from very severe muscle pain and joint pain. So that's how it is. Another infection caused by Rickettsia group of bacteria species Rickettsia quintana. Rickettsia quintana. Actually, this is known as a trench fever, otherwise 5-day fever. So this can be treated with antibiotics such as tetracycline, group of antibiotics such as doxycycline and tetracycline. and even you can use chloramphenicol also to treat the infection caused by Rickettsia quintana, one of the species of Rickettsiae group. It leads to an infection called as trench fever. Trench fever, the person will be having fever, body ache, weakness, so there will be a joint pains. So that is called as trench fever. Next infection caused by Rickettsiae, Susugumushi. Susugumushi is one of the species of Rickettsiae group. So this Rickettsiae Susugumushi causes an infection called as scrub typhus. It is also one kind of fever only, so caused by Susugumushi. So the meaning of this Susugumushi is Susuga means dangerous, Mushi means might. So that's how the name has come, and it is first observed in Japan. So the name Susugamushi is derived from a Japanese language, that is Susugamushi. Susuga meaning dangerous, Mushi meaning mites. So it is caused by a bacteria called Orientia Susugamushi. A scrub typhus is caused by Orientia Susugamushi. So the most common symptoms of scrub typhus, they are fever, headache, body ache, and sometimes there will be a rashes on the body. So it is very commonly seen in Asia, Indonesia, China, and Japan, India even, and northern Australia. So the people who travel to such areas, they get infected from this Rickettsiae Susugamushi that causes a scrub typhus. Rickettsia group of bacteria, especially Coxiella burnetii, is a species which causes Q fever. Q fever. It is a disease caused by the bacteria Coxiella burnetii, one of the species of Rickettsia. So this Coxiella burnetii, it causes infections among goats, sheep, and cattle. Mainly, it causes infection in animals. So this bacteria is found in the placenta, amniotic fluid, urine, feces, and milk of infected animals. If you take example goat, so there will be a Rickettsia bacteria, that is Coxiella burnetii, in the placenta, amniotic fluid, feces, and urine and milk of the goat. So when the person comes in contact with, human being comes in contact with the dust infected with animal feces, urine, milk, and birth products, so then the person will get infected from the Coxiella burnetii. So here the people will suffer from flu-like symptoms such as what we have seen now, corona infection. There will be a running nose, there will be a fever, cough, cold, there will be a chills, weakness, and muscle pain, joint pains. So they all will be there. The person will be suffering from flu-like symptoms and fever, chills, fatigue, and muscle pain. So this is about the Q fever caused by Coxiella burnetii, one of the species of Rickettsiae group. The treatment for Q fever caused by Coxiella burnetii is doxycycline antibiotic. You can use in a acute and mild forms. Doxycycline is enough. If the condition is chronic and running for a long period of time, you can use antibiotic doxycycline and hydroxychloroquine. You have seen now people who are suffering from corona infection, they are giving hydroxychloroquine as a prophylaxis. As a prophylaxis, they are giving hydroxychloroquine. So the same drug can be used to treat this Q fever.